How's it going, guys? We have a difficult question for neuroanatomy. I'll keep this very clean and simple, not waste our time with garbage, okay? Because you do not need to know 50 different structures, but USMLE wants you to know these three structures bilaterally. We are looking at a 2D cross-section of the medulla, okay? Cut right to the chase, tell you exactly what you need to know. In this vignette, we've got weakness, and we've got three upper motor neuron findings, Babinski, clonus, hyperreflexia. That sounds like the corticospinal tract, doesn't it? Okay. Vibration, proprioception are intact. That means our dorsal column's not fucked up, right? Okay. There's no dysmetria or ataxia. Dysmetria, inability to judge distance properly, finger nose testing, shin heel testing. Ataxia, wobbly gait. This sounds like cerebellum. Means our cerebellum's not fucked up, right? Okay. This is what you need to know. Choices A and B refer to the pyramids, the medullary pyramids. These are the corticospinal tracts before they enter the spinal cord. The correct answer is B. So if we have a corticospinal tract lesion in the actual spinal cord itself, it is ipsilateral. Do not fuck that up on USMLE. If we gave you a right-sided corticospinal tract lesion in the spinal cord, you'd have right-sided weakness and UMN findings. However, if you have a pyramidal lesion, which is just superior to the decussation point of the corticospinal tracts, it's contralateral. Correct answer is B. If A were the answer, which it's not, we would have left-sided weakness and left-sided UMNs. Choices C and D are the medial lemnisci. These are the extension of the dorsal columns into the brain. Now in parallel, if we had a dorsal column lesion in the spinal cord itself, it's ipsilateral. Do not mess that up. However, in the brain, it's the opposite. It's contralateral. This is superior to the decussation point at the arcuate fibers. Another thing you need to know is in the dorsal columns, you've got the medial fasciculi gracili, which carry vibration proprioception from the lower limbs below T6. Laterally in the dorsal columns, you have the fasciculi cuneati, which are vibration proprioception from the upper limbs, T6 and above. They ask that on USMLE. Okay, if you get, let's say, loss of vibration proprioception in the left leg, then in the spinal cord itself, you choose the left side, and you choose the medial letter for the dorsal column, which is the fasciculus gracilis on that side. Okay? But in the brain, contralateral for the medial lemnisci. In the brain, contralateral for the medullary pyramids for corticospinal. You said our answer is B here. Now, E and F, you do need to know, these are the inferior cerebellar peduncles, and despite their name, it's still part of the medulla. This will be the answer in USMLE if you get ipsilateral, not contralateral. Ipsilateral, dysmetria, and ataxia. Okay? So they'll tell you a dude has wobbly gait, he's got impaired finger-nose testing on the left, and the answer would be F. On the right side, it'd be E. Now, something else we could mention is F could also be involved with lateral medullary syndrome, Wallenberg syndrome, which is going to be ipsilateral Horner syndrome and hoarseness of voice and dysphagia. Horner syndrome is not just Pancoast tumor impinging on the superior cervical ganglia. You need to know it's also lateral medullary syndrome, which is going to be posterior inferior cerebellar artery, PICA, or ipsilateral vertebral artery. You need to know both of those. And then medial medullary syndrome, that's going to be the anterior spinal artery or the paramedian branches. But medial medullary syndrome will be the answer if you have a stroke plus ipsilateral tongue deviation. So medial medullary syndrome, ipsilateral tongue deviation, lateral medullary syndrome, ipsilateral Horner, dysphagia, hoarseness of voice. Inferior cerebellar peduncles, ipsilateral dysmetria, ataxia. Medial lemnisci, contralateral vibration proprioception. Medullary pyramids, contralateral weakness, UMN findings. Choice B, correct answer. You know the deal. I'm teammate more content on the sales Rachel. Appreciate your time. That's it.